It is amazing that 2024 is almost over. It was very innovative and transforming year for me personally and for healthcare industry. Things have matured, new technologies have been invented. Now we are at the nexus of major change. In 2024, election is over. We know possible future healthcare policies which will determine how healthcare delivery models will be operating, and it will depend on the honesty of our political system and politicians how we will be navigating pandemic of chronic diseases in United States. We spend about $3.8 trillion every year on chronic diseases. I have been following all the political news for last 3 years, and especially when Robert Kennedy started his campaign, Make America Healthy Again. I initially felt that at least somebody recognized that this is a problem. Jury is still not out, but whatever I read online and in print, they are focusing only on what is wrong with America, what is wrong with the healthcare system, and how they are going to fix, but they're still too far away from why America is sick. In a healthcare system in any country, four moving parts, and they all need to click together. First is the population or the patients. Second, payers or health insurances. Third, healthcare delivery models. Fourth, healthcare policies and administration. In the United States, nobody is honest. Patients are not doing what it takes to stay healthy. They are not utilizing preventive care facilities, preventive care services as they are intended to be used. Healthcare delivery models are the most dishonest, and they develop services and promote disease rather than prevention. And I do not blame them. They are in business of delivering care, and they are incentivized or paid to keep you sick. Or in other words, they don't make money if you become healthy. So you are in direct conflict with their business model. Our healthcare policies are not in line to help you keep healthy or for preventive care. In a healthcare system where you are paid for transaction, you are paid for keeping you sick, not maliciously. You become what you are paid for, and our healthcare delivery model is adverse. They are paid only for the services. In last 2-3 years, there has been a talk about value-based care. Now we are talking about the outcomes. And unfortunately, out of whole healthcare delivery model and specialties, one who could really help you is your primary care. In the United States, out of $3.8 trillion, only 3.4% goes to primary care. Primary care is underused, and if there has to be some comprehensive solution to this pandemic and bankrupting our nation, it has to be primary care. We all need to be honest in this quest to become healthy and make America healthy again. Let's look at our population. Americans are known for being healthy and doing what it takes to stay healthy. Newer generation is not as healthy as we are or our parents were. The average life of our younger population is going to be less than what we enjoyed or would enjoy or what our parents are enjoying. This got to change. We need to start with the grassroots, changing the habits of our younger population so that they do not develop risk factor for chronic diseases. Eventually, they don't develop chronic diseases and complications of chronic diseases. It breaks my heart. I immigrated from India for better life, and I see in healthcare, they are getting relatively better than us, and we are going backwards. Once you see more, feel more, and can understand more, that is a very painful state of affair. We are a small practice in Central Florida, And our goal is to be the change what I'm talking about. We want to embody the change what America needs. In healthcare, every physician or healthcare delivery model or policy affects your care, or there are three kind of care which is delivered to you. One is acute care, second is chronic care, third is preventive care. Acute care is something, the care you need when you're sick. If you call your doctor, you may not be able to get in to see them for 3 to 4 months. So our patients end up relying on costly emergency rooms, urgent care centers, and those physicians there do not know you. So that leads to expensive, unnecessary care. America needs care now, or access to care now. We need to build models or create schedules where if you're sick can be seen by your primary care physician same day. In our practice, we offer same day visits. Walk-ins are always welcome and use technology to its fullest. We use digital health, including telehealth, in a way which is very unique to provide extended hour access and to get you seen in the same day. Second, chronic care. Chronic care is an insidious disease. It starts with our personal habits. We do not exercise, we do not eat right, we do not rest properly, we do not sleep properly, we are always stressed, we manage our mind poorly. That leads to risk factor for chronic diseases, leading to chronic complications, and $3.8 trillion our nation has to pay. This is all preventable. Unless we get some diseases out of aging, all the chronic diseases lie in our daily habits. Preventive care. People do not go for preventive care. Only 28% of United States population gets age-appropriate preventive care. So this is a perfect storm. When you're sick, you don't get access. By and large, not have good habits, and you do not avail preventive care. Healthcare industry and healthcare innovation has improved significantly. Artificial intelligence, wearables, gene editing, digital technologies, they are improving what is available to take care of you. Where we are failing on healthcare policies, wrong incentives for a healthcare delivery model, personal integrity to stay healthy, and use preventive care services the way they are intended. Our healthcare system provides you with 100% free preventive services which you never use. Let's make a pledge or adopt that in 2025 we will develop healthy habits. It is estimated that if you develop these 5 habits, you could expect to live on an average 14 years longer than if you don't develop or you keep status quo. Number 1, exercise. 30 minutes, 5 days a week, preferably 7 days a week. Number 2, eat balanced diet, which should include primarily plant-based, healthy fats, and healthy proteins. Number 3, manage your stress. Number 4, sleep 7 to 9 hours a day. Number 5, meditation. If you put these 5 habits into your daily routine, you will prevent all chronic medical problems, and you will be living on an average based on the data about 14 years. And it's not the number of years which is important, it's how you live is more important. In 2024, there has been significant improvement in artificial intelligence. Now, with artificial intelligence, I could read or get the highlights of your whole chart in a one page where I could read and understand what's going on with you. That gives me proper insight into your disease process, and we could make it actionable plan for you. Gene editing. See, the medicine has gone from just population health now to precision medicine. Here, technologies exist where We could edit your own genome. What we used to believe written by gods, now simple technologies exist where they could edit your both existing cells and your germ cells. That is leading to eradication of a lot of metabolic diseases and heritable diseases. If we develop good habits, we could enjoy a long, beautiful life. 3D bioprinting, it is not a dream. As we speak, the trials are underway where we'll be able to bioprint organs, kidneys, skin, they're already being tried. Wearables, whether it's a continuous glucometers, now your smart watches and phones will be able to get a lot of your biological data, which will help you or give you feedback where you can continue to improve and get the things better. Robotic surgeries, you may be in a small rural town, but with robotic surgeries controlled by a Harvard professor, you could expect equitable care and best procedures available to you anywhere you want. Telehealth, I think that will be the life changing. Now, we in our practice will be implementing a tele program where we should be able to manage 60 to 70% of your chronic care with the telehealth. You don't need to be here in our offices to get refills, lab results, radiology reports, or to know what your specialist said. We need to be team based. We need to improve the things better for each other. Then, with precision medicine, we will know what is ailing you and what we could do. At this time, there is a need to develop those 5 life-changing habits which will improve your life and will give you extra 14 years. Healthcare has to improve and America has to become healthy again. We must have individual ownership to get better and change our habits. Start exercising, eat right, sleep good, manage your stress. This is not a rocket science. We all know what to do. We just don't do it. We fail in execution, not in knowing. We, in our practice, we want to be the change, what I'm talking about. We intend to improve your engagement with everything at our disposal to get you involved into your disease process. We will provide you same-day access and walk-ins welcome and telehealth. We will provide you with evidence-based care for your chronic diseases with a focus on prevention and incorporating wellness into your day-to-day life. We will move from transactional model to value-based care where you get outcomes. If you're a diabetic, there is a prescribed standard which we should meet, and we are already doing it. But in 2025, we will provide you with utmost evidence-based care. We will have built the teams around your care. Let's all join together to get healthy and make America healthy again. I hope I've convinced you that it's time to get better. It's time to be personally responsible. And we will be creating a lot of content to help you through this journey. Like, share, and subscribe to our channel, Kundlas MD. I will see you in next video. I wish you happy, healthy, prosper 2025. Thank you very much.